Hello, I'm Dr. Sarada P, Gastroenterologist at Yashoda Hospitals, Somajiguda. One of the frequently asked questions is how the gut is affected in pregnancy. Pregnancy affects the gut or the gastrointestinal tract in many ways. Not just the intestine part of it, but also the liver and the gallbladder part of it. We'll go through each one in detail. The first one and the most common complication or complaint in pregnancy is constipation. So, because of the gut hormones and because of the position and weight of the baby, the gut tends to slow down, or the movement of the stool tends to slow down. So, constipation is one common problem that is noticed in pregnancy. As a result of constipation, one can suffer from piles or hemorrhoids and fissures as well. When there is hard stool coming out, pregnant mother has to strain, there tends to be bleeding or pain during passing motion. So this tends to be as a result of constipation. The other common symptom experienced by pregnant mothers is reflux, typically heartburn. The vomiting, morning sickness that occurs in the first 3 months tends to kind of worsen this symptom. So often women lose weight in the first trimester as a result of both reflux and vomiting. But reflux particularly tends to get worse as the baby gets bigger, because the baby tends to occupy most of this area in the stomach and the food tends to get pushed up. This is also related to mechanical factors like the size of the baby, and also related to hormonal factors which relax the muscle that stops or prevents reflux. So there is muscle at the lower end of the food pipe that stops acid coming up into the food pipe. So that tends to get loosened in pregnancy. So these are the two common intestinal related problems. The third one is gallbladder stones. Just like I described, hormones slow the gut down, hormones slow the gallbladder down as well. So there tends to be more fatty bile which tends to lump and form stones in pregnancy. So previously symptomless stones become symptomatic in pregnancy, and new stones can form in pregnancy. So if a pregnant mother has episodic pain, not constant pain, episodic pain, especially after eating a fatty meal, they suddenly develop pain either in the upper abdomen or on the right side of the abdomen, this needs to ring alarm bells. So a simple ultrasound scan will be able to diagnose the gallstones. The final one I wanted to talk about is liver. So how does pregnancy affect the liver? There are two types of conditions that happen to liver. One is pre-existing liver conditions that can get worse in pregnancy or get diagnosed in pregnancy, and secondly, very pregnancy-specific liver conditions. The latter, that is pregnancy-specific liver conditions, tend to occur more towards the end of the pregnancy. They can sometimes be very serious, both for the mother and the baby, and often the only treatment remains delivery of the baby as soon as possible. The other liver conditions that tend to get worse in pregnancy tend to be fatty liver or viruses. And fortunately, we do screen all pregnant mothers across the world for viruses in pregnancy. As a result of this, we identify those who have viruses, and we can do two things. One is to treat the mother. The second is to prevent the mother transmitting the virus to the baby. So this screening program is a very successful program which has identified liver disease early on due to viruses. The other conditions like autoimmune liver disease and other genetic diseases also can manifest in pregnancy.
If you found this video useful, like, comment, and subscribe for more health updates.